dressing up for a delicate and detailed job.
It is a very technically demanding, and it's also very important for the patient from a point of view not just of function, but this is your face, it's you, it's real. So the cosmetic component also comes into play.
Facial traumas make up 10% of all emergency department presentations in the Territory. Surgeon Mr Mahiban Thomas has worked with Territorians suffering facial cancers. He's reconstructed eye sockets broken in helicopter crashes and mended the damage from car accidents. But it's the number of broken jaws he sees in the Territory that he finds most alarming.
To fracture the mandible, you need 70 times the force of gravity. It's a fair amount of force that needs to be delivered.
The surgeon says facial fractures are rarely an accident, and the Territory has some of the highest rates of broken jaws in the world, on average about one a day. Demand for surgery is so high that this small jurisdiction, making up just 1% of the nation's population, was amongst the first in the world to use a hybrid surgery theatre with built-in CT scanners for this kind of procedure.
Around the world, 1 in 10 patients with facial fractures are women. For us, it's 4 of 10. So that's a large number. You've got to understand that for every facial fracture that comes in, there's probably about maybe even 100 who don't reach that point of a facial fracture.
The Northern Territory records some of the highest rates of domestic violence in the country, and Mr Mahiban Thomas says 90% of what he sees is alcohol-related. Domestic violence assaults involving alcohol have steadily increased over the past decade in the Territory. In the 12 months to September, more than 2,500 incidents were reported. That equates to about 7 a day. Mr Mahiban Thomas says the Territory also has some of the highest rates of recurrent facial fractures in the world, meaning many of his patients return with a second break to their jaw.
I still remember my anaesthetist at that point in time asking me, are you getting anywhere doing this? One case at a time, we're getting somewhere. We need to make sure that he can eat again, that he can function again and be a human being. It's never hopeless, it's a human being at the other end.
His message to Territorians is to get treatment for alcohol abuse and anger management problems before it causes this kind of damage. Letitia Lemke, ABC News.